Our vaccine wall of defence has been a huge success. We think so far it's saved 105,000 lives and prevented some 24 million infections. And today we're going to go a step further by accepting the advice of the independent JCVI that anyone that is severely immunosuppressed should be offered a third dose. The reason that we are doing this is based on the advice of the JCVI and the data that they've seen. It suggests that people in such a situation that are immunosuppressed, they may not have the same level of protection from 2 doses that other people do. That's why we think it's absolutely right that we top up their protection by offering this third dose as part of their primary vaccine schedule. We've accepted the advice of the independent JCVI, and they've been very clear that this third dose should be offered to anyone over the age of 12 that has a severely weak immune system, and that's exactly what we're doing. Of course, we keep this under review at all times, and should their advice change at a later date to include a different group of people, of course, we would follow through on that advice. Today's announcement is not part of the wider booster campaign. That remains on track to start later this month, but of course it's subject to the final advice of the JCVI. No, the JCVI's got a really important job to do. I think they're an incredible bunch of people, amongst the best in the world, and I want to give them the space and the time to do their work. In the meantime, that doesn't prevent us, the government, in preparing to offer vaccines, whether that's the booster program or a program to offer vaccines to children, but all of this is subject to the view of the JCVI. Today's announcement doesn't affect in any way whatsoever our preparations for the booster campaign. As I say, I expect it to start as scheduled this month, but it is subject to the final view of the JCVI.